Welcome back, everyone. Time for our Eye on Vision. This week we have Dr. Matthew Witmer. He's a retina specialist here in Havasu. Welcome.
Thank you.
Thanks
it's
for coming.
Pleasure to be here.
Okay. Now we're going to talk flashes and floaters. What is that?
So flashes and floaters are a common symptom that we see as retina specialists. Flashes are often described as lightning going off in the eye or strobe light effect in the eye. And floaters are basically things floating around in the eye people see. Sometimes people describe them as flies floating around inside the eye or seeing things. But they're a very common symptom we see as retina
Are they
specialists.
treated very differently?
No, they're
kind of the
mostly,
same?
a lot of times they're indications of one problem, but the symptoms often run together, although sometimes people have one and not the other, but usually they come together.
Okay. Who's at risk for this?
So flashes and floaters are often seen in patients that have retinal tears or retinal detachment. It can be associated with aging. And also is more commonly found in patients that are very nearsighted or have a risk factor called lattice degeneration. But they can be symptoms of a wider problem and cueing the patient and the doctor in that they need to investigate to see if the patient has a serious problem in their eye.
What's the history? Could it be a result of an injury at all, external injury?
Yeah, oftentimes you can develop flashes and floaters after external injury. But flashes and floaters can be caused by a number of actual eye conditions, such as retinal tears or retinal detachment. However, there's other causes of flashes and floaters as well, such as bleeding in the eye or inflammation in the eye. So it's very important that that the patient see eye care professional.
Okay, so if you have any of those, get to see an eye specialist.
Absolutely.
Right away.
You'd want to see them right away because in a lot of these problems, the sooner the patient is treated, oftentimes the better they do. And
so it could progress, it could get worse if you don't get treatment right away?
Exactly. It could progress and become more difficult to treat. So a lot of times, if it's treated early, you can prevent further vision loss and save vision. Okay.
Are people with diabetes more prone to the flashes?
Not often. However, in terms of flashes and floaters, patients with diabetes might have the same symptoms. We see flashes and floaters more commonly in just patients as they age. Specifically, it's associated with just aging of the eye.
Okay, now I know we had a question on social media. What is Weiss rings? What are those?
So a very common cause of flashes and floaters is as the eye ages, the gel pulls off the back of the eye. And when we're young, there's gel inside the eye, and it's very solid. But as we age, it shrinks and contracts and pulls off the back of the eye, and that's called a posterior vitreous detachment, which is very different from a retinal detachment, because posterior vitreous detachment is a normal phenomenon of the eye. A Weiss ring is what the doctor sees when this event has happened, this posterior vitreous detachment. And that's why it's just so critical that patients see their eye care professionals, because if they're aware that it's a Weiss ring, then they'll know that that's a normal phenomenon and they don't have a serious eye problem that can affect their vision.
Okay, we will do that. See an eye specialist. There's some right here in Havasu. Thank you, Dr. Whitmer. I have a solution. Just don't get old. Sounds like a lot of those things are from age. Okay, thanks for joining us.
It's a pleasure to be here.
We'll see you next time.
Thank you.